Welcome to the Concierge Medical Marketing Podcast, the show dedicated to helping concierge medical practices grow and thrive. Hosted by Schwartz, a digital marketing expert with over 25 years of experience and a passion for improving American healthcare by helping concierge medical physicians succeed. Here's Schwartz.
Hello and welcome to the Concierge Medical Marketing Podcast. I'm your host, Steve Schwartz, and I'm so glad to have you along on our journey and our discussion today. My guest is Jay Kimmel of Upswing Health. Jay, thank you for being here with us today.
My pleasure. Thank you, Steve.
Truly. We've recently become acquainted, and you were telling me off camera a little bit about your background in Upswing Health and how you're helping patients in the orthopedic space a little differently than traditional. Could you first tell us a little bit about your background, your training, where you started, and kind of the story of how we got to today with Upswing Health, please?
Oh, sure. It's my pleasure. Thank you, Steve. So I'm an orthopedic surgeon. I specialize in sports medicine. I trained at Columbia after going to medical school in Rochester and doing a fellowship in Philly, and went out into practice, taking care of high school and college and recreational athletes. But I always understood the importance of primary care. And I was fortunate enough when I first started my career in Hartford, Connecticut, to become a faculty member at the University of Connecticut in the Department of Family Medicine and Orthopedics. And I was responsible for teaching the family medicine residents for over 35 years, and really feel that if we're going to fix healthcare, it's really important to have a well working primary care system. In my practice, I did sports medicine, so I did surgery on knees and shoulders mostly, and took care of various athletes. And we created, with my co-founder, Steve Schutzer, some centers of excellence here in Hartford, Connecticut, that were so successful that they were written up in the New England Journal of Medicine as the best way for private practice orthopedists to work together with administration to create value. So we're real believers in value-based healthcare, and we feel that, if primary care groups can work successfully with specialty groups, that the future is really bright. And as you mentioned, I retired from clinical practice at the end of last year to be full-time with Upswing Health, which is a virtual orthopedic company that uses some pretty cool technology. And we combine that with the ability to talk to a health coach who's an athletic trainer within 15 minutes, as well as to set up a virtual visit with a orthopedist within 24 hours. And with that virtual approach, we can solve about 80% of low and medium acuity orthopedic problems. And as we talked a little bit about off camera, we work very closely with primary care groups, particularly DPC and VPC groups, to really help them co-manage their patients.
So it sounds a lot like telehealth / potentially urgent care, maybe, for orthopedic situations where your patient may not be able to come in, or maybe they just have some sort of problem like, wow, my elbows really started hurting the last day or two, and what's going on here? You're able to assist with that. Am I on the right track here?
Yeah, we really think that it's important that from the moment that you're injured, that you have the opportunity to talk to somebody who knows what they're talking about. And of course, if you have a concierge doc, you're going to be much more likely to be able to get that information quickly. And a lot of people, unfortunately, don't, and they wait many weeks to get in to see their primary care. Or sometimes the worst thing to do is to go to the ER or urgent care center if you don't have to. And wherever you are in this country, many times when you go to the ER, unless you absolutely have to, you wait for a long period of time, you get a big bill, and it's a very, very inefficient way to get care. And think about it. I been a doctor for over 40 years now, and I still constantly get phone calls from friends and family, and sometimes patients about, I hurt myself. What do I do? And what Upswing does is we give that information to everyone. And it's almost like creating a situation where you have an orthopedic surgeon in the family.
Yeah, I love it. Yeah. Who do we call to get our questions answered? And maybe considering it as a first level triage, somebody did something. It's like, you do need to go to the emergency room. This is not something we can help you with virtually here, as opposed to, I've got a repetitive stress injury in my wrist or my elbow or knee or whatever it might be. And here's perhaps some therapy or physical therapy, or you can probably be fine with some ibuprofen for a few days and icing and elevation, correct?
It is. And that's the key thing, is that it's that triage function that we think is so important. Yeah, there are times, and I've certainly gotten phone calls where someone's called me and hurt themselves. You know what, that you need to go to the ER. But it's sometimes things may hurt a lot, but from the mechanism of injury and the fact that they can walk on it, that it's not that serious. An ankle injury is a real classic one, which is if you sprain your ankle running down a field, it can hurt and get very swollen. But it turns out that if you can walk on it, and if it doesn't hurt when you touch it on the bone, your chances of having a fracture are so little. And so many times during my career, I saw athletes in particular, they'll hurt themselves during the game, and then they'll wind up going, finishing the game, and then go to the emergency room, waiting for 6 hours to get an X-ray, which is normal. It would be so great if they could talk to somebody who would say in that situation, you know what, that one can wait till the morning, ice and elevate, and then we'll get an X-ray if we need to tomorrow, as opposed to having a horrible night in some ER somewhere.
Exactly. It's a shame because our ER doctors work so hard and they're so well trained and they're not appreciated. But I can't tell you the last time I spoke to somebody who said, oh, yeah, I had to go to the ER and it was an amazing experience. And they saw me within 15 minutes and I was out of there within the hour and it only cost me $20. I've never heard that story. It's truly, truly unfortunate that the predominant number of stories you hear about the emergency room or emergency department are negative stories. And it's like, whatever you do, don't go to the emergency room if there's a problem, and on the other side, obviously the whole discussion about insurance, many of these insurance programs that people have somehow the ability to afford tied together with the marketplace, you're still going to spend $1,000 or $1,500, copay to go to the emergency department. And, I forgot what the percentage was of bankruptcies that are attributed to a medical issue, basically bankrupting families. And it's a heartbreaking, I don't remember the number, but it's a heartbreaking statistic when I last read that.
Right. And we know we work in the state of Connecticut, we take care of their employees, of which there's a couple 100,000. And we know that 4 or 5 years ago, they spent $2 million taking care of people with the diagnosis of ankle sprain, which means those folks went to the ER, had negative X-rays. Now, sometimes I can imagine, I've done it myself, where you have a really bad ankle sprain and you just really feel like you need to do something like that. But most of those people were the ones that I described earlier, where they just really didn't need to go. So, but there are times, I don't want to be saying that you should never go to the ER, but we just want people to go when they need to go. And that also goes for seeing orthopedists. As it turns out, some of the studies have shown that, for example, a lot of back surgery is very unnecessary. They estimate 50% of it. And a lot of that comes from, if you have a back problem and you go directly to a neurosurgeon, you're so much more likely to get an MRI scan and so much more likely to wind up having surgery, some of which may not be necessary. And lastly, Steve, we just got some data back from the state of Connecticut, and one of the other things that we hadn't really thought about, we know that we help people, we know we save money, but you know what? Our data showed that when you looked at those that came to us compared to those that went on the traditional pathway, we decreased opioid use like from a lot to zero on that. So another
Fantastic.
really important thing is keep people away from ERs and urgent cares where they'll get a few Percocets, and we know a few of them are going to go on to have real problems.
Right. It's a shame when the medicine causes a whole another area of problems that also need to be treated down the line. And unfortunately, the opioid crisis is all about that. I
Right.
know some people need it for handling pain, but part of my hope and desire is that we find a better way to help people manage pain without the addictive properties of the medicine.
That's right. Yeah.
I'm not a doctor and can't speak to it. Just as a dad and a guy I've had actually 2 back surgeries so far. I'm in my early 50s, but I had the herniated disc in my low back. It was so bad with the pain radiating down the back of the leg and whatnot that you can't stand, you can't sit, you can't lay down, nothing's comfortable. It's like you get to a point where surgery is the only option.
Yeah, it sounds
And
like in that case it was. Yeah,
yeah,
that's the
truly.
50% that was needed. Yes, Steve.
But I had my last one about a year ago. The surgeon had told me afterward, I forgot the word he used, but essentially that my lower back area where the disc herniated was something like a train wreck, or I forgot the exact words he used, but it was very important that I got the care, and it's healed beautifully. So very grateful for that. Question for you is, obviously your business is focused on the 15-minute sort of triage, I guess, for lack of a better word, and also the ability to see somebody within 24 hours as truly a specialist. I noticed on your website, you have an AI symptom assessment tool. And as a person who's in-depth involvement on the internet, and every day I'm learning something new about AI technology, can you please tell us a little bit about your AI symptom assessment tool, please?
Sure. So one of the things that we do is we want to be able to help people 24 hours a day, 7 days a week. And one way to do that is with technology. So we've created what we call a symptom assessment tool, which is a series of algorithms that duplicates the doctor-patient experience. So if you came to my office with a shoulder problem, or you called me on the phone with a shoulder problem, I would ask you the same questions that I've been asked the last 30 years. And then in my mind, I would have a differential diagnosis or a list of possible conditions that I would share with you. Well, our technology does that. And we do it all the way from the neck down to the toes. And we have a number of primary care groups that are very interested in using our technology to help their patients if they can't get in to see them right away, to give them sort of an idea of what it could be. And also maybe even as these were written by leading orthopedic surgeons, to maybe check a little bit on what their diagnosis is as well. So we're very excited about that. It's a work in progress. We have a tool that's out there, but what we're in the process of doing is making it even smarter by adding more and more AI and training the model so that it can be. Right now, it's about 80% accurate, Steve, but we'd like to get it up to about 90 or 95% accurate using small language training of the model.
Love it. And your patients who have used it, are they finding it easy to use as far as the user experience?
Oh yeah, everybody loves it. It's really easy. It's really easy to use, and it gives you answers that are they're not going to scare you. They're not going to make you think that you have cancer or you're going to die tomorrow. Like sometimes if you just read stuff on the internet, it's very well written, and we have about 1,000 people a day all over the world accessing our content because I think it's pretty well written.
Love it. One thing I saw on your website as well, not just talking about muscle and joint rehabilitation, but also virtual athletic training. I thought that was fascinating. In other words, leading people, perhaps, and I'll let you speak on this, how to properly exercise without hurting themselves, how to warm up, how to cool down. Could you speak on that, please?
Yeah, in my practice, I worked hand in hand with athletic trainers for almost all of my career at the high school and college and levels. And I developed a deep respect for what they do. They see the athletes there on the field or in the training room, and they have to triage and then give them appropriate care pathways under the supervision of a physician. And that's what our athletic trainers do too. You can, if you're one of our clients, and if the concierge medicine docs used us, and we do work very closely with them, they could use our technology, and they also could have their patients, instead of waiting for a visit to go see a physical therapist, for example. And we're big believers in physical therapy. Sometimes it takes a little while to get in there. Sometimes, as you said, it's expensive. Our athletic trainers can give them rehab programs immediately, like right away. And then the good thing about our athletic trainers, just like in a high school or college setting, is that they'll check back in with you the next day and the day after that. And patients really love that. And that leads to very high satisfaction ratings because, as much as doctors like me would love to be able to call everybody, every day after they see us in the office, that doesn't happen. But having somebody call who really cares about you and then can help you and triage you further is really very useful.
You've mentioned that you care for the employees of the state of Connecticut and athletes and whatnot. But for somebody listening to this, can just a person who's not affiliated with some big group or organization also just reach out and utilize your services?
At the present time, we don't really have a D2C function. We will eventually, but at the present time, our users are really businesses and clients and primary care docs and captives that have hired us. What people can do, though, and what they do at the rate of about 1,000 a day around the world, is if you Google things like ankle sprain or foot bruise or hand injury, Upswing usually comes up in the first couple, and they can read about the content. They can access the self-help programs that are built into that content. And someday down the road, they'll be able to set up appointments to talk with us.
Right. So that's the direction you're going to be able to help the end consumer outside of, an arrangement with another business, but not today.
But not today. But what we really feel is the place that's most useful for us, honestly, is the is concierge and DPC and virtual primary care groups, because we feel we can help those doctors really co-manage their patients. We understand that it's the primary care doc's patient, but if they can add our services, work with us, refer to us, at the moment they see the patient in the office, or if for some reason they can't get to that patient and refer them to us, then we're different than, say, our competitors that are physical therapy groups. We're built to work hand in hand with other physicians. So every time one of our athletic trainers sees somebody, we create a note, and that note goes back to the primary care doctors to keep them in the loop, just like we would do in a multi-specialty group, for example.
So I love it. How long have you been in business?
About 4 years now. Yeah.
Excellent.
Yeah.
That's so exciting, and it sounds like you're really growing. You've got a great footprint on the internet, so as people search, they can find you. In my digital marketing space, we call that SEO, search engine optimization.
Yes.
What content do you add to your website with links to that content, so that when people search, obviously the web page or content pops up toward the top of the Google search. Well, that's great. So I guess one final question I have for you: if a concierge or DPC physician or office manager is listening to this podcast interview, really likes what we're talking about, and wants to get more information about how they could potentially work with their practice with Upswing Health, how can they get in touch with you?
Sure. Well, I would love to hear from them. You can reach me at my initial J, Kimmel, at upswinghealth.com, or info. And again, we love working with primary care doctors, whether it be concierge or direct primary care or virtual primary care groups, and they seem to really like working with us as well.
Nice. Well, you seem like a great guy, and I'm thrilled to have the opportunity to meet you and get to know you better. And I wish you all the very, very best with your business and, elevating healthcare for all Americans who desperately need, an improved experience, easier access, great care, done quicker, and less cost and hassle. I mean, that's a kind of a winning combination in my book.
Well, thank you. Thank you for the kind words, Steve.
Well, truly my pleasure. So thank you for taking the time to be with us today. One quick thing I do want to mention, as we talked a little bit about digital marketing, I wrote a book called The Definitive Guide to Winning with Digital Marketing for Concierge Medical Practices. And if anybody would like a copy of that book, it's completely free. It's available through our website, conciergemd.marketing. It's on the homepage. Just go there, scroll down, and pop in your email address, hit the button, and it'll send you a link where you can download the book, read it with my compliments. And obviously, if you have any questions, need any help, need any guidance, please feel free to reach out to me personally. 772-304-2420 rings right to my iPhone. So Dr. J. Kimmel, truly a pleasure spending time with you today. And I do appreciate you taking the time to be on our podcast.
Thank you, Steve.
Yes. Have a great day. Bye, everyone.
Thank you for tuning in to the Concierge Medical Marketing Podcast. Please subscribe and leave a review wherever you listen to podcasts, and stay connected with us on social media. To speak with Stephen Schwartz about growing your concierge medical practice, give him a call at
772-304-2420
or visit our website at conciergemd.marketing. We will see you next time.